Have you heard? Stevie Wonder stunned thousands of fans after announcing that he'll be having a kidney transplant later this year. The musician made the announcement at an event in London over the weekend. The 69-year-old did not reveal the reason for the transplant, but he said he wanted to avoid rumors about his health. The process of finding donors is a difficult one, especially for African Americans. The problem is a large one, and it's affected a number of high-profile celebrities. The late Marion Barry, mayor of D.C., former Georgetown basketball star Alonzo Mourning, Natalie Cole, the great singer, comedian George Lopez have all needed kidney transplants, just to name a few. Fortunately, for all of them, they were able to find a donor. But for the average person, the lack of matches can be a matter of life and death. This is an important conversation, and joining us to discuss Dr. Alexander Gilbert, transplant nephrologist. Say that for me, that word.
Nephrologist.
Nephrologist, got it. Okay, MedStar, Georgetown University Hospital. Gary Simmons, who's in the process of having a kidney transplant at MedStar at Georgetown later this summer. Let me ask you this. What does that mean? You're in the process of having a transplant.
It means that I've located someone to donate on my behalf. Now it's just about them pairing me up with someone that matched my blood type in order for me to receive a kidney.
Yeah, so the person you've identified will donate a kidney to somebody else, and then somebody else. I love that program. Okay, how long have you been waiting?
Since November.
Okay. You excited?
I am very excited and encouraged, and I think the hospital has been doing a great job with walking me through the process.
Yeah. Doctor, talk to us why more people aren't donors. You know, and how acute is this shortage?
The shortage is tremendous. There are about 97,000 people in the country who are waiting for kidney transplants. We do about 17,000 transplants a year. The problem, as you said, is especially important in the African American community. African Americans are roughly 4 times more likely to develop kidney disease in their lifetime than a Caucasian. We get roughly similar numbers of deceased donors, whether African American or Caucasian, but among living donors, while there are over 4,000 Caucasians who receive living donor transplants a year, there are under 800 in the last year African Americans who receive living donor transplants. So that's really where the lapse is. Yeah. And so this has been a great story.
Yeah, let's go back to lifestyle. Is there anything we can do to lessen the risk, to bring that number down? You mentioned African Americans are more at risk. Say 4 times as
4 times more likely.
Anything we can do about that? Lifestyle changes or anything?
You eat healthy, keep a healthy weight, get to be screened, see a doctor, make sure if you have things like hypertension or diabetes that it gets caught early, where we can hopefully stretch things out before there's any damage.
Yeah, my thing whenever I hear a number like that, we're more at risk. My thing to people is treat yourself as if you're high risk. There's no downside to that, to start making some lifestyle changes now. What has it been like for you? How did you know that you needed, a kidney?
Mine was over a process. I initially, back in 2002, was diagnosed with hypertension, high blood pressure. It kind of escalated into the diabetes realm of things based on my lifestyle of working and eating on the go, not taking care of myself. And I allowed what I thought was the right mode. I allowed medicine to dictate what I was doing or not doing. So the more medicine I was on, I felt I was okay because I'm on the medicine. It only caused more problems.
Yeah, and you're a small guy. You look good. You look fit. This is an inside job, right? Stop going by how you look, and maybe even how you feel.
Right. Well, I ended up losing weight. I was in probably about 270 pounds at one point.
270?
270. I'm at 170 now. So I ended up having gastric sleeve surgery to reduce the weight as well. So it's some steps that I had to take to kind of get my body in alignment. Just when I think I put out one fire, there'd be 2 other fires going on in my body.
Yeah, Dr. Let me give you the last word. What do you say to people out there who are not donors, okay, who for a lot of reasons, will not donate? I'm told religion sometimes is the reason for that. Other people, you just don't have the information. Let me give it to both of you. What do you say to people who say, that's not for me?
I would just say that, do the research. Because that's the biggest part. I think a lot of people that I ran into, they was misinformed about what they can or cannot do, and just that led to them not doing it.
You don't need both kidneys, do you?
Nope, you only need one. What I tell people is, if you're at all curious, if you're at all interested, please contact us. To start the process is not a commitment to go ahead with the living donation. The first part of the process is just for us to give you the information to find out about living donation.
If I'm a donor, does that move me up on the list? If say, another family member comes up and is in need or something like that, is there a benefit for me being a donor other than just the good deed of donating?
For being a donor, no. It's about, we want things to be altruistic. We want people to do this out of the goodness of their heart. We do